Bismillahirrahmanirrahim. This video will describe brief introduction of thyroid metabolic hormone. The thyroid metabolic hormones are secreted from the thyroid gland that is positioned below the larynx on each side of the trachea, below the larynx on each side and anterior to the trachea. This is one of the largest endocrine glands and weighs about 15 to 20 gram in adults. The average size of the thyroid gland is its length is about, each lobe length is about 4 to 6 centimeter, while width is about 1.2 to 2 centimeter, and its thickness is 1 to 2 centimeter. The isthmus, that is the area that bridges the two lobes of the thyroid on each side. It is the central area, isthmus, that connects the two lobes. So this is thin and flat, and typically it is 1.5 centimeter wide. There are some variation in the size. The thyroid gland is larger in women and in people with iodine deficient area and pregnancy or puberty due to changes in the hormone. And it is smaller in elderly individuals and those with certain thyroid conditions such as atrophy in the hypothyroidism. So the glands secretes thyroxine T4 and triiodothyronine T3 and calcitonin. The T3 and T4 are responsible for metabolic rate of the body. They increase the basal metabolic rate, and their absence, both of these hormones, their absence will decrease the metabolic rate by about 40 to 50%, while their excess may lead to increase of the basal metabolic rate of BMR up to 60 to 100%. And these hormones are controlled by a master regulator in the pituitary gland, that is TSH, or thyroid stimulating hormone, that is secreted by the thyrotropes. The calcitonin is another hormone that is secreted by this gland, and it is responsible for the calcium metabolism. Two hormones that are secreted by the thyroid gland are thyroxine, or T4, and triiodothyronine, that is T3. So the T4 is present in abundance. About 93% of the body thyroid hormone are T4, while T3 is present in the circulation only in 7%, while the activity of this T4 is that it is converted to T3 in tissue, while T4, it produces the effect. It is the metabolically active form of the hormone, and the function of both are same. The intensity of T3 is 4 times intensity of action is 4 times that of the thyroxine, or T4, while this T4 is slow in action, while the T3 is rapidly acting and shortly lived in the circulation. So these differences can be summarized as that T4 is present in high quantity in the blood. It has got a low potency, while its duration of action is long, and T3 is present in low concentrations, and it has got a high potency, and it is short-lived and rapidly acting. So this thyroid gland is lying anterior to the trachea. This butterfly structure is lying anterior to the trachea, and on each side of the trachea. It is composed of two lobes, and these two lobes are connected by isthmus. This is a small organ that has the weight of about 15 to 20 gram. It is composed of closed follicles histologically, and these follicles are these diameters is about 100 to 300 micrometers, and they are filled with secretory substance that is colloid. It is a gel-like substance, and the lining of this gel-like substance is colloid, and this is lined by cuboidal epithelial cells that secrete the hormone into the interior of the follicle. This colloid is large glycoprotein thyroglobulin that contains the thyroid hormone. So this colloid is the reservoir of thyroglobulin. This is a glycoprotein, and it contains the precursor of thyroid hormone, both the T3 and T4. And the thyroid hormone are secreted into this colloid, and later this is absorbed into the blood. This is a highly vascular organ, and it receives about 5 times blood supply to its weight. As you can see, the abundance of blood vessels are there in this picture. There is another cell that is parafollicular cell or C cell, and this cell is responsible for secretion of calcitonin that is involved in the plasma calcium ion concentration regulation. So the cells that are there are follicular cells that produce thyroglobulin and thyroid hormone, and C cells or parafollicular cell that secrete calcitonin and regulate calcium metabolism. So just to review, what are various cells that are here? What is the summary, histological summary? So there are follicles. These follicles are responsible for hormone storage in the form of thyroglobulin in the colloid, the cuboidal cells that synthesize the hormone T3 and T4, the C cells or parafollicular cells. They are responsible for secretion of calcitonin that is regulating the calcium ion metabolism, and various capillaries that provide blood flow for the transport of the hormone. So iodine has got an essential role in the formation of thyroxine, and this thyroxine is the major hormone that is secreted by the thyroid gland. It is required about 50 milligram per year, 50 milligram per year, that equals to roundly about 1 milligram per week, and it is sufficient. This 1 milligram per week is sufficient for normal thyroid production. So this is uh, included in table salt as a public health strategy to prevent the deficiency of iodine, and the fortified table salt is used, and typical ratio for this fortified table salt is 1 part sodium iodide per 100,000 part of sodium chloride. Then what is the fate of this ingested iodide? This ingested iodide is reabsorbed from the gastrointestinal tract like chloride, and this is distributed in the same manner into the body. About 20% of the iodide is taken up by the thyroid gland for hormone synthesis, while 80% is excreted via the kidney. And here is the summary of these steps. It is taken up into the fortified table salt, enter the bloodstream like chloride, and 20% is taken up, or one-fifth is taken up by the body, while 80% is excreted from the body through the kidney. So first step in the formation of the thyroxine hormone or thyroid hormone is the transport of iodide from the blood into the thyroid glandular cell and follicle. For this, sodium iodide symporter is important. So this sodium iodide symporter it results in the trapping of the iodide. So there is first entry of the iodide into the thyroid cell, and this is the first step in the thyroid hormone synthesis, and there is active transport of the iodide from the blood stream into the thyroid follicular cells. This is mediated by sodium iodide symporter on the basolateral membrane of the thyroid cell. So this co-transport works as the two sodium ions. They go along with one iodide ion into the cell together with sodium iodide symporter. The energy for this come from the sodium potassium ATPase, which maintain ATPase pump, that is over here, and it maintains the low intrasodium calcium concentration that drive this force for sodium re-entry into the cell. This passive sodium influx pull iodide inside against its concentration gradient. Then iodine is concentrated in the thyroid cell, in this thyroid cell, to about 30 times of the blood concentration of the iodine in normal concentration. And during high activity, this concentration may increase up to 250 times of the blood concentration of the iodine. This process of concentration of the iodide ion inside the thyroid follicular cells is termed as iodide trapping. This iodide trapping is influenced by thyroid stimulating hormone that stimulates the iodide pump and enhances the trapping. The removal of the pituitary or hypophysectomy, it greatly reduces the trapping process due to TSH log. So apical transport to the follicle of the iodine, how does that occur? This iodine or iodide ion exits the cell into the follicular lumen through a pendrin transport. A chloride iodide counter transporter. At the same time, thyroglobulin is secreted into the follicle. It contains tyrosine residues that will later bind iodine to form T3 and T4. So this pendrin is responsible for counter transport of iodine or iodide ion into the follicular lumen. So there are three important steps in the iodide ion trapping. First is the iodide from the blood to the cell, and sodium iodide symporter is responsible for this function, and it is actively transported into thyroid cell. And iodide then in the follicle, it is exchanged for chloride through pendrin, and this leaves this iodine inside the colloid or follicular lumen. Then sodium regulation is done by sodium potassium ATPase pump that maintain the sodium gradient for the symport function. The synthesis of the thyroid hormone begins with the production of thyroglobulin. This is a large glycoprotein precursor that is secreted by thyroid follicular cell. So the organelles that are involved in its synthesis are endoplasmic reticulum. It synthesizes the thyroglobulin peptide backbone through the tyrosine residues, and Golgi apparatus modifies and packages this thyroglobulin precursor. The molecular weight of this thyroglobulin is about 335,000 Dalton, and about it is composed of 70 tyrosine residue precursor for thyroid hormone that is secreted into the follicular lumen. So this completed or precursor thyroglobulin is exocytosed into the follicular lumen or colloid. This colloid becomes the site of hormone synthesis and storage. The tyrosine residues in the thyroglobulin, they are then iodinated to form monoiodotyrosine, diiodotyrosine, and triiodotyrosine, MIT, DIT, and TIT. Uh, and when monoiodotyrosine couples with diiodotyrosine, it forms triiodothyronine. And when diiodotyrosine they couple together, two of the diiodotyrosine, they couple together, they form T4 or thyroxine. So even after T3 and T4 are formed, this these are attached to this thyroglobulin, and they remain the part of the thyroglobulin molecule and stored within the colloid. When needed, this thyroglobulin is droplet of the thyroglobulin is endocytosed. Through pinocytosis, it goes inside the cell, it is digested, and then hormones are released into the bloodstream. So this table is summarizing these steps. The thyroglobulin is a glycoprotein precursor containing tyrosine that is synthesized by endoplasmic reticulum and packaged in the Golgi of the thyroid follicular cells, and it is released into the colloid or into the follicular lumen. And the role of this thyroglobulin, it is a scaffold for iodination and hormone synthesis. The hormone is formed within the thyroglobulin and stored there in the colloid bound to thyroglobulin. And whenever needed, it is taken up into the cell through pinocytosis, digested by various proteases, and the hormones are released into the bloodstream. A key step in the thyroid hormone synthesis before iodine can attach to the tyrosine residue in the thyroglobulin is the oxidation of the inactive iodide form into an active iodine form capable of binding to tyrosine. So the starting molecule that is coming inside the thyroid hormone is the iodine. This iodine is absorbed from the bloodstream into the thyroid follicular cell via the iodide pump, sodium iodide symporter. And when it goes inside at the site of the oxidation, the site of the oxidation is the near the apical membrane of the thyroid epithelium, right where the thyroglobulin enters the lumen. So the enzyme that is responsible for this process is thyroid peroxidase or TPO. This enzyme catalyzes this oxidation process. It works along the hydrogen peroxide H2O2, which provides the oxidative power. The iodide is then this iodide ion is then converted into nascent iodide or triiodide. These are highly reactive and ready for uh, iodination of the tyrosine. So this step, this peroxidase, thyroid peroxidase, is a critical step in the hormone synthesis, because if there is no oxidation, there will be no hormone production. And this enzyme is inhibited by some anti-thyroid drugs like propylthiouracil. So there will be decreased or absence of the hormone formation. Sometimes this enzyme is genetically absent, so there will be complete stoppage of the formation of these thyroid hormones. So this is the summary of these steps. The iodide is inactive form of iodine transport into the thyroid cell, and then the enzyme is the peroxidase that catalyzes the iodide, and the hydrogen peroxide is a cofactor providing the oxidation potential, and the oxidized iodine uh, or nascent iodine or triiodide, they bind to tyrosine in the thyroglobulin at the apical membrane of the thyroid cell, and this is a critical step in the formation of the thyroxine or triiodothyronine. Then there is a step of organification of thyroglobulin, that is iodination of the tyrosine. The organification is a crucial step where oxidized iodine binds to tyrosine residues on thyroglobulin, uh, forming the building blocks of thyroid hormone. So this process, organification, refers to the enzymatic binding of iodine to tyrosine residue within the thyroglobulin molecule inside the thyroid follicular lumen. There is role of thyroid peroxidase, the enzyme thyroid peroxidase. It not only oxidizes iodide but also catalyzes the iodination process. This makes the reaction extremely rapid, and this process occurs within seconds to minutes. Finally, the 1/6 of the tyrosine residue on the thyroglobulin are iodinated. These iodinated tyrosines eventually lead to the formation of monoiodotyrosine, diiodotyrosine, 2-tyrosine, triiodothyronine, or thyroxine. This is the summary of organification. The tyrosine residues on the thyroglobulin are the substrates, and the oxidation of the iodine or oxidized iodine that is oxidized by thyroid peroxidase binds to tyrosine and form monoiodotyrosine and diiodotyrosine. The process occurs in the follicular lumen, that is colloid, and the time period for this process is within seconds to minutes. Then the coupling reaction in the thyroid hormone synthesis occur. Once tyrosine residues, they uh, are iodinated on the thyroglobulin, forming DIT and MIT, diiodotyrosine and monoiodotyrosine. The coupling reaction occurs. This is the final key step in the formation of the active thyroid hormone. So T4, it comprises of about 93% of the secreted hormone we have seen earlier. It is formed by two DIT molecule coupling together, while D3 is formed by the coupling of one diiodotyrosine and one monoiodotyrosine together, and this T3 it comprises of about 1 by 15th or 7% of the uh, hormone that is present in the blood. So there is another form, that is reverse T3. This is also formed by the diiodotyrosine and monoiodotyrosine, but it is biologically active. It plays a role during stress or illness, but not significant in healthy humans. The coupling steps locks the final hormone structure. T4 acts as a reservoir being converted into T3 in the peripheral tissue like liver and kidney, and proper balance of these T3 and T4 is critical for metabolic homeostasis. So this is a biochemical synthesis pathway for thyroid hormone from tyrosine, that is showing how iodination, coupling, and finally these processes lead to formation of T3, T4, and reverse T3 or reverse triiodothyronine formation. The tyrosine, that is the base amino acid structure, it contains a phenol ring, and enzyme peroxidase causes uh, this peroxidase activates the iodine. This peroxidase activates the iodine, and monoiodine tyrosine is formed by attaching one iodine to the tyrosine. So the result is iodine at one position in the ring, phenol ring. Then diiodotyrosine, two iodine atoms are attached to the aromatic ring of the tyrosine. Now these two iodine are attached, and then there is coupling. So when 353 triiodine is formed, 353 triiodine is formed by monoiodine and diiodotyrosine, that is active and potent hormone that is present in a small amount, and it is 5 times more potent than T4, whereas the reverse T3, it has got 335 triiodothyronine. So here this is also formed by DIT and MIT, but it is biologically active, and it acts as a regulatory form during stress and starvation. The T4 or thyroxine hormone, it is formed by coupling of two DIT, and it is primary circulating hormone that act as a prohormone, and later it is converted into triiodothyronine in the tissue. So the thyroid hormone is stored in the thyroglobulin, and this unique storage capacity of this thyroid hormone, because a large amount of the hormone is stored in inactive form. The stored form is thyroglobulin, that is a large glycoprotein that is rich in thyroxine and triiodothyronine. Each molecule of thyroglobulin contains about 30 molecules of thyroxine, uh, that is T4, and a few molecules of triiodothyronine, and these are stored inside the follicle as part of the colloid. So they have got storage capacity, so they can supply in the period of deficiency, they can supply the hormone to the body. So the supply can occur for the next 2 to 3 months. So they have enough hormone to supply in case of deficiency. So the deficiency in the during the deficiency state, the symptoms are not immediate. Symptoms are uh, often delayed for months. So this period offers a buffer period that protects the body from immediate hormone disruption. Thank you for watching this video. If you have any query, please write in the comment box.